This is part 3 of the Abnormal Psychology, chapter 16 by the David Myers 8th edition psychology textbook. So where we last left off was on disturbed perceptions. So disturbed perceptions is where a schizophrenic person may perceive things that are not there, like hallucinations. So hallucinations, they see things, they could hear things, sometimes they smell things that might not be in the area, and they might even taste things that are there. So all this stuff could be going on. Most of the time they perceive things that really just aren't there, like visually and auditory, but you kind of hear less about the olfactory and the tasting of things. So when we look at inappropriate emotions and actions, some people who have schizophrenia, they experience this. They may have apathy. They might show no emotions at all. So if someone dies, instead of actually mourning the death of someone, they might actually be laughing at the death of someone. Now, another thing that we see with schizophrenic patients is they may be catatonic schizophrenic. A catatonic schizophrenic person is someone who likes to repeat their actions a bunch. Or they're just motionless. So they might rub their arm for hours on end. I mean, just say, and they might even rub the arm area just raw. They don't stop. It's just continuous. Or they might rock in their chair continuously. And it's the same thing with the other part where if they may be motionless. Now, you can see this. You can see catatonic patients with our nursing homes, with people who are extremely sick. You can see that there, but catatonic schizophrenics, this is some of the motions that they do. We do have subtypes in schizophrenia that you kind of need to make sure you are aware of, because if you look at the AP exam, it might not just ask you about schizophrenia. Schizophrenia, remember, is just a category of an abnormal disorder. But there's things in schizophrenia that make people have different kinds of schizophrenia. So schizophrenia is the category, and then we got all these nice little subtypes that are in there. When we look at schizophrenia, there's positive and there's negative symptoms. So schizophrenics have inappropriate symptoms like hallucinations, the disorganized thinking, and the deluded ways that are not present in normal individuals. These are positive symptoms. What positive symptoms are saying is that they got a check plus here that normal people don't have. Normal people don't have hallucinations. We don't hear or see things that don't exist. Our speech pattern is pretty organized, and we don't have deluded ways. I mean, you know, if we've got let's say a 1 GPA, we know that, you know, maybe going to UNC or NC State might not be a possibility. Like, that's the kind of things that you wouldn't see in a normal individual. Now, schizophrenics can also have these negative symptoms, and schizophrenics also have an absence of appropriate emotions, and so that means they would have apathy, expressionless faces, rigid bodies that are present in normal individuals. So this is where they are not like normal people. This is where they miss the normal things that most people have. Most people are sympathetic when someone passes away. Most people express themselves pretty easily. Like, they move their hands around when they talk, or you can tell that they're smiling. I mean, most of the time we don't hold our bodies very rigid like we're in pain or we're catatonic. So this would be a negative. They are missing these things that other people have, other normal people have. So there's chronic and acute schizophrenia. When schizophrenia is chronic, which means it's going to be a lifelong thing, it is very doubtful that the recovery is going to go well. Chronic schizophrenia normally develops in your teenage years. There's just different reasons why they believe some people develop schizophrenia. There's genetics, there's environment, maybe the child had a high fever when they were young, and there's different things, but high fever and genetics, an excessive amount of dopamine, these are the things that leads to schizophrenia. Now, if a person develops it as they get older, like maybe they have a period of schizophrenia, the recovery is much better, and these people normally show positive symptoms. So there's a difference. Chronic, they normally have negative symptoms. With the acute schizophrenia, where it's like they have an episode of schizophrenia, it's normally positive symptoms. When we look at subtypes, what we're looking at when we're looking at these subtypes, what we're looking at here is like paranoia, disorganized, catatonic, and undifferentiated, and then residual. So what I want you to know with paranoia, schizophrenia, is these people have delusions or hallucinations, and a lot of times they feel like somebody's after them. And they also will feel like maybe they have some grand way to save the world or save, the planet. Disorganized is that their symptoms are they have a disorganized speech and behavior. They have the flat or inappropriate emotions as well. Now, I don't have disorganized speech. I paused the video and moved the frame around so that you could see the different subtypes because it was kind of cut off. Now, catatonic schizophrenics, they are the people who they might have the excessive movement or no movement at all. And so sometimes in catatonic schizophrenia, they'll repeat back what you say. They do this parrot-like talking, which they'll not only just the parrot-like talking, but they might also like mimic your movements. And then the undifferentiated, they're like all over the place. They have a little bit of paranoia, a little bit of disorganized, a little bit of catatonic. So they have a little bit of each of these symptoms. And then residual is after the hallucinations and the delusions disappear, you still have schizophrenia. It's just that you're like in remission. So it's the withdrawal of it. Understanding schizophrenia. Schizophrenia is a disease of the brain, and it's really kind of something that we see with an excessive amount of dopamine, that neurotransmitter. And so what you need to know is that excessive amount of dopamine will lead to schizophrenia, which is why their attention is all over the place, because dopamine deals with attention. So brain scans show abnormal brain activity in the frontal cortex, the thalamus, and the amygdala of schizophrenic patients. And you got to understand, the way that they're hearing things or they're seeing things all the time, this would make anybody a little bit upset. But schizophrenics are not aggressive. They are not hostile. They're not people who are harmful to other people. They're normally harmful to themselves. A lot of schizophrenic people will end up homeless because they can't seem to maintain jobs. So a good portion of the homeless population in America actually has abnormal disorders. So when we look at the abnormal brain, here's the schizophrenic brain, and you can see that there's just there's some differences between the brains. Some other stuff that we think that might happen to people who have schizophrenia is that their mom might have had the flu when they were actually pregnant. And so this is why we have moms making certain that they get the actual flu vaccine. So when you look at genetic factors, if your parents suffer from schizophrenia, both of them, the percent of you actually developing schizophrenia is higher. And you can see with identical twins, one might have it and then the other one might not have it. But genetics also plays a role here. So the following shows the prevalence of schizophrenia in our identical twins when we look around the country. So biological factors, we look at the psychological stuff, we look at the environment. Even though nobody is identical other than our identical twins, we do see that schizophrenia kind of runs in families. There seems to be a genetic predisposition. So early signs of schizophrenia. If a mother has had schizophrenia, any kind of birth complications like where a long birth or oxygen deprivation and low birth weights are some, short attention span and poor muscle coordination. They're disruptive and they have a withdrawn behavior. And they normally have a withdrawn behavior because they feel a little bit different than everybody else. They're emotionally unpredictable and they don't really work well with other people because they have this withdrawn behavior, because their attention span is all over. So they have poor peer relations and solo play. So the last thing that we're going to look at, or one of the last things we're going to look at, is personality disorders. So personality disorders, these are things that are persistent throughout your lifetime. And the most famous one is the antisocial personality disorder. They did call it a long time ago sociopaths or psychopaths. So when you look at this is a disorder in which a person, and it's normally men, exhibit a lack of consciousness or lack of conscience for doing anything wrong. They don't feel bad about what they do, even if they hurt friends or family. These are not people who you really want to hang around with. They're typically your serial killers, your criminals. So like John Wayne Gacy or the BTK killer, which the other picture was showing you. These are people who enjoy what they do, which is kind of making other people feel bad because they're anti to society. So anything that society holds value, they don't care about it. So like mood disorders and schizophrenia, antisocial personality has biological and psychological reasons. When we look at the environmental stuff, we normally see that kids who have committed crimes at an earlier age, they have a lower level of stress hormones, and because they feel like they're freer to commit these crimes. So these are people who might be antisocial as they develop. If you look at the PET scans, this is of 41 murderers. What we see is that there's lower levels of activity in the frontal lobe, and remember the frontal lobe has to deal with judgment, and so they have less activity in the frontal lobe, which might mean that they're not really reacting to things or thinking things out the way a normal brain person would. So the likelihood that one will commit a crime doubles when you actually add in childhood poverty. When poverty is added into the situation, we actually see some real bad issues coming in, because maybe they're growing up in an environment that teaches them that this is the right way to cope and deal with mechanisms that are problems. So when you look at the rates of psychological disorders, you can see all these things that we have in America. So this is just the percent of Americans who are experiencing it. And just again, here's prevalence of psychological disorders around the world. When you look at risk and protective factors, like what can you do, here's just some factors that you could do to try and prevent a psychological disorder from developing. There's just a couple of things that I want to go over with you. I want you to know about somatoform disorders. Somatoform disorders are where it would be like a conversion disorder, it would be like hypochondriacs. There's nothing really wrong with them, and you can run every medical test. It's just that something doesn't seem to work right. Like with hypochondriacs, they feel that they're always sick. With a conversion disorder, which is a somatic form disorder, they will wake up one day and their arm won't work, and there's no medical explanation to why their arm won't work. So remember the packet that I gave you guys. Make sure that you go back over it, because I added some other personality disorders that you should go ahead and review. Abnormal, even though it fascinates you guys, it's not going to be the biggest portion of the AP exam, but it is a good sized portion. I mean, you definitely need to know it, and you need to know the biological causes of these disorders, and not only the biological causes, but like environmental stuff that occurs. So always know the nature, nurture of everything.